Welcome back to Dr. Stewart's in the Know, and I'm Dr. Stewart. We are going to talk about breastfeeding today. Yay, I hope you're excited. So, there are a lot of benefits to breastfeeding. And when I talk about breastfeeding, I'm also including those moms who are pumping and giving express breast milk, or those moms who are giving donor express breast milk. But in general, we're just going to put it all under the label of breastfeeding. So we'll talk about benefits of breastfeeding in 4 categories: the benefits to baby, the benefits that go into childhood, the benefits to mom, and the benefits to the family in general. It's been shown that breastfeeding decreases the risk of sudden infant death syndrome, or SIDS. It decreases the risk of pneumonia, decreases the risk of otitis media, which is ear infections, and decreases the risk of gastroenteritis, which is the illness that causes vomiting and diarrhea. All of these are benefits to the baby. Now, there's some benefits that are ongoing into childhood, especially the longer you breastfeed, the better or the more likely your child is going to benefit from these. A decrease in obesity, a decrease in the diseases associated with obesity, like high blood pressure and type 2 diabetes, a decrease in the incidence of asthma and eczema, a decrease in the risk of childhood leukemia in those infants who were breastfed for at least 6 months or longer. Because it's been shown that the immune system is revved up even the more, or you have a better immune defense the longer you breastfeed your child. And also, the longer you breastfeed, the higher in IQ points your child has in general. So, healthy kids, smart kids, hey, who wouldn't want that? But there's benefits to the mom. The longer mom breastfeeds from a cumulative standpoint, so you breastfed 3 kids, you breastfed 1 kid for 4 months, another kid for 6 months, the third kid for just 2 months, there's a cumulative effect that's associated with a decreased risk of breast cancer, decreased risk of ovarian cancer, decreased risk of high blood pressure, cardiovascular disease, and type 2 diabetes, and a decreased risk and postpartum depression. So those moms who are able to achieve their breastfeeding goals, they are less likely to experience postpartum depression. On the flip side, for those moms who start breastfeeding but they get frustrated, they don't achieve their breastfeeding goals, that can be associated with an increased risk of postpartum depression. So it's very important that we have the support system in place. And I'm happy to say that so many hospitals around the country are proactive. They have the support that mom and baby need to successfully breastfeed. A lot of hospitals are trying to become baby friendly. So we have come a long way. We have more to go, but we have come a long way in putting measures into place to make sure that mom and baby can successfully breastfeed and have the support system that they need for long-term success. Now, the benefit to the family in general is that you get to save money. On average, it's a $2,500 saving per year for those babies who are breastfeeding. So it's a win-win. So I want to encourage you moms out there who are thinking about breastfeeding, who are in the midst of breastfeeding and you're struggling, and get the support that you need. Reach out. It doesn't matter if you've already breastfed 3 other kids. Get that support because information is changing and we're evolving. So it's always better to have that support system, to talk, to be able to share your frustration, to try this technique or that technique that might work better for you and your baby. So I encourage you. You're doing a great job. And for those moms who are like, I can't exclusively breastfeed, it's just not working, I still encourage you, like, you're doing a great job. We have our recommendations, we have our ideal, but we also have reality of what works for you and your family. So no condemnation, no guilt trip. I'm saying whether you do it 1 week, 2 weeks, 5 months, 6 months, I want to encourage you that when you do breastfeed your baby, when you give your baby express breast milk or donor milk, you're giving them medical food, meaning you're giving them the resources to build up their immune system, to be able to fight off infections, to just it's long-term benefits. And so what you're doing a great job. So kudos to you. Keep going. Stay encouraged. Get the support that you need. Talk to your pediatrician. Talk to your lactation consultant, and reach out and give yourself a pat on the back. Make sure that you're mentally well, that you have someone's cleaning helping you with the dishes or vacuuming the floor, bringing you food, that you're in a good headspace so that you can be rested and be able to take care of your child. So congratulations. Keep up the good job, and do me a favor, give me some comments down below if you have good resources for that you can share with others who are looking at this video. That would be helpful. And like us, subscribe to us, tell your friends and families about us, and keep coming back. All right, until next time, I'm Dr. Stewart.